You take your pills every day, believing they're helping your health. But what if I told you that some of the most common medications, taken by millions over 60, could be quietly damaging your heart? As a heart health educator, I've seen far too many people suffer not from the disease itself, but from the side effects of the drugs meant to treat it. This video isn't to scare you, it's to empower you. Today, I'll show you the 7 common drugs that may raise your stroke risk, and more importantly, how to avoid a heart attack and protect your heart. Let's start with one of the most commonly used pain relievers, NSAIDs, or non-steroidal anti-inflammatory drugs, like ibuprofen, Advil, and naproxen, Aleve. Many seniors take these daily to relieve arthritis, joint pain, or back pain. But what most people don't realize is that NSAIDs can quietly raise your blood pressure, cause fluid retention, and put extra strain on your heart. Over time, this pressure can lead to irregular heart rhythms and even heart failure, especially in people over 60. They can also reduce kidney function and interfere with heart medications, making things worse without obvious symptoms at first. If you're using NSAIDs daily, talk to your doctor. There are safer alternatives like turmeric, curcumin, omega-3 fatty acids, physical therapy, acupuncture, or warm compresses. Pain relief should not come at the cost of heart damage. If you're managing type 2 diabetes, your doctor may have prescribed a medication called pioglitazone, part of a group known as TZDs, thiazolidinones. These drugs are meant to lower blood sugar, but they come with a hidden cost. They can cause fluid retention, which leads to swelling in the legs, shortness of breath, and in some cases, congestive heart failure. For seniors, especially those who already have heart issues, this is a dangerous combination. What's worse, these medications can mask early signs of heart failure, like fatigue or mild swelling, so you may not notice the damage until it's serious. If you or a loved one is over 60 and taking pioglitazone, ask your doctor, is there a safer alternative for blood sugar control? Should we monitor heart function more closely? Managing diabetes is crucial, but not at the cost of weakening your heart. Sleep problems are common after 60. That's why millions of older adults rely on sedative hypnotic medications like Zolpidem or Valium to fall asleep. But here's the truth. These medications slow down your nervous system, including your heart rate and breathing. While that may seem helpful for sleep, it can also trigger or worsen sleep apnea, a condition where breathing stops temporarily during sleep. This puts dangerous pressure on the heart and increases the risk of stroke and heart attack. Sedatives can also interact poorly with heart medications like beta blockers, reduce alertness, and increase the risk of falls and confusion, especially in older adults. Insight starts with safer choices. Limit screen time before bed. Try natural supplements like melatonin, low dose. Practice deep breathing or relaxation exercises. Don't trade a few hours of sleep for long-term heart damage. Many older adults are prescribed tricyclic antidepressants like amitriptyline or nortriptyline, not only for depression but for chronic pain, migraines, or sleep issues. But here's the danger. These drugs can interfere with the electrical signals that regulate your heartbeat. They may cause irregular rhythms, low blood pressure, or a condition called heart block, where signals between the heart's chambers get delayed. In seniors, especially those with existing arrhythmias or slow heart rate, this can be life-threatening. Even worse, these medications often go unmonitored for years because people don't know they're harming their heart. Watch for symptoms like dizziness, fatigue, fluttering in the chest. Safer options exist. SSRIs like sertraline are generally better tolerated by the heart. Mental health matters, but so does your heartbeat. When allergy season hits or a cold comes on, many people over 60 reach for decongestants like pseudoephedrine or phenylephrine, found in popular over-the-counter meds. These drugs shrink swollen blood vessels in your nose to help you breathe easier. But here's the catch. They also narrow blood vessels throughout your body, including those that supply your heart. That can raise your blood pressure, speed up your heart rate, and trigger irregular rhythms. For seniors with existing heart disease or hypertension, this can become very dangerous very quickly. You might feel jittery, anxious, lightheaded, or dizzy. Don't ignore these signs. Safer alternatives: use saline nasal spray. Try a humidifier or warm compress. Consult a pharmacist before buying any OTC decongestant. Just because it's sold without a prescription doesn't mean it's safe for your heart. If you suffer from acid reflux or heartburn, chances are you've taken a PPI, a proton pump inhibitor like omeprazole or Prilosec or pantoprazole. They're commonly prescribed and often used for months or even years without much thought. But recent studies show that long-term use of PPIs can quietly increase the risk of heart disease, especially in seniors. How? By reducing stomach acid. PPIs interfere with the absorption of vital nutrients like magnesium, which is essential for normal heart rhythm. Low magnesium levels can cause fatigue, irregular heartbeat, and muscle weakness. PPIs can also alter gut bacteria, promote inflammation, and increase risk of stroke and kidney damage over time. Warning: if you've been on PPIs for more than a few weeks, talk to your doctor. Is it still necessary? Can I manage reflux with diet or lifestyle instead? Safer habits for reflux: avoid eating late, reduce caffeine, alcohol, and spicy foods, sleep with your head elevated. Short-term relief shouldn't lead to long-term heart damage. Let's talk about one of the most commonly prescribed heart medications, calcium channel blockers, especially verapamil and diltiazem. These medications help relax blood vessels, reduce blood pressure, and manage chest pain or arrhythmias. But in older adults, they can sometimes do too much, causing the heart to slow down excessively. This can lead to fatigue, dizziness, swelling in the legs, or even dangerously low heart rate. These effects are often mistaken for aging, but in reality, your heart might be struggling to keep up. Another concern: these drugs can interact with other heart meds, amplifying side effects or lowering effectiveness. Warning: always monitor symptoms and ask your doctor. Is my pulse too low? Should we consider adjusting the dose? In some cases, newer calcium channel blockers or different classes of blood pressure medications may be more appropriate. Don't ignore the quiet signs. Your heart deserves attention, not assumptions. So let's recap. The medications we've covered, whether for pain, sleep, blood sugar, mood, or even heart problems, were designed to help. But when taken long-term, without regular review, and especially when combined with aging, they can quietly become harmful. Your heart doesn't always shout when it's in trouble. Sometimes it whispers through fatigue, swelling, or shortness of breath. You don't have to panic, but you do need to be proactive. Ask questions, watch for subtle symptoms, stay informed. The goal isn't to stop your medications suddenly. It's to start a conversation with your doctor. With the right knowledge, you can protect your heart, extend your life, and feel better every single day. Because the best medicine is awareness. If this video helped you understand your medications better or made you stop and think, don't keep it to yourself. Leave a comment. Have you or someone you love experienced side effects from any of these drugs? Share this video. You might just help someone avoid a heart attack. Subscribe to the channel for more heart-smart tips designed for people over 50. And most importantly, don't stop taking any medication without talking to your doctor first. But now you can ask better questions. You can be your own best advocate. Because the more you know, the more you protect your heart.